According to USA Today, Americans spend around $86 billion every year trying to combat lower back pain, the second most common neurological malady, behind only headache. It can range from a mild discomfort that's gone within a few days of taking it easy, but in some cases can be severely debilitating and can even affect children, usually as a result of carrying rucksacks, also known as backpacks. As in most fields of medicine, however, prevention is better than cure and certainly cheaper. So this lecture is designed to help you to understand the basic anatomy of your spine, to alert you to some of the problems that may arise, and to arm you with a plan of action to reduce the risk of becoming a sufferer. Now, the good news is that a specific exercise regime can significantly increase the health of your lower spine and keep you active for life. So let's begin by looking at the structure of the spine. This wonderful structure consists of 24 movable vertebrae, which are divided into several major sections. There are the 7 cervical vertebrae, the 12 thoracic, and 5 lumbar, plus the 9 fused vertebrae that make up the sacrum and the coccyx. And the job of the vertebrae, in essence, is to protect and support the spinal cord, in addition to bearing most of the weight put on your body. Like all bones, vertebrae have a hard, strong outer shell called the cortical bone. You may remember from our lecture on bones. The inside is called the cancellous bone, and this is soft and spongy. Groups of ligaments hold the vertebrae together, and tendons attach muscles to the vertebra. Now, all these bones stacked up wouldn't easily allow for movement if there weren't some form of cushioning between them. These are the intervertebral discs, which are the shock absorbers for your body. The discs have a strong outer ring called the annulus, and each disc has a soft fibrogelatinous center that helps in this kind of cushioning work. Now, the top 2 vertebrae, also known as the atlas and the axis, respectively, have great degrees of freedom and so allow the many movements of the head and neck. The base of the movable spine is the sacrum, connecting the spine to the pelvis via the 2 sacroiliac joints, effectively the point where your upper body meets your lower body. Like other points in the body, various joints, you'll find cartilage is here to absorb shock. In fact, both haline cartilage around the ends of the bones and fibrocartilage between. Yet, unlike other joints, they're not very movable. To give you an idea of the restriction, it only allows for around 4 millimeters of movement when you bend forward. The joint's got a unique locking device that's essential to maintain stability in the pelvis when you're walking, as it allows for weight to be transferred from one leg to the other. Now, you'll have no doubt noticed that the spine is curved. We have this thoracic rounding in the upper body, being referred to as a primary curve due to it forming in the embryonic stage, whilst the cervical and lumbar curves are known as secondary curves due to them developing after birth, i.e. when the baby first learns to lift its head, and then when it first stands, respectively, that's when we develop those secondary curves. Although the curvy female back has long been a regular subject of great painters throughout the history of art and remains a driving force in the fashion world's desire to create the perfect dress, there's a little more to it than purely aesthetics. The design is actually an engineering marvel, as a perfectly straight spine would make it really difficult to maintain a stable centre of gravity, particularly when walking. And also, a straight spine would lead to dangerous loads being applied to the lumbar vertebra. The curves allow for the upper body loading to be dissipated through the muscles, and so protecting the vertebra low down in the column. Each vertebra consists of a main body to the front and a central aperture. There are 2 transverse processes and then a spinous process to the rear, which is the thing you can feel when you run your hand down your back. The vertebrae stack conveniently to allow the holes to line up, providing a protected canal down which the spinal cord runs. This mass of nerves branches off into 31 pairs of nerve roots that feed out throughout the neural foramen, or gaps, in the sides of the bony structure and reach out to all parts of the body, allowing for messages and information to constantly transfer between the brain and the outer extremities. Being an ingenious feat of engineering, the spine is capable of movement in many directions. We actually have extension, we have flexion, we have lateral flexion to the side, and we also have rotation. In reality, our everyday activities require a combination of these movements. If you pick up a bag or a box, or you put something on a shelf, for instance, these actions are brought about by the muscles that attach to the spine, and these can be split into two groups. Those nearer the surface that are primarily linked to movement of the arms, and then the deeper muscles that move the vertebral column itself. Now, the surface back muscles are the trapezius that runs from the base of the skull and the vertebra C1 down to T12, cervical down to thoracic 12, inserting into the clavicle, the acromion, and the scapula, the shoulder blade at the back. It can lift, can lower, it can retract the shoulder blade. Then the levator scapulae, which reaches from vertebrae C1 to C3, sometimes to C4, and into the upper part of the shoulder blade. Now, in addition to assisting the trapezius in lifting, this also tilts your head to the side. The rhomboids, so the rhomboids major and minor, start at vertebra C7, go down to thoracic 5, and attach to the inner border of the shoulder blade. And from this position, they can only do one thing. If you imagine they're running horizontal, all they can do is retract your shoulder blade. And then we have the serratus anterior, which is the antagonist partner, having the opposite function to the rhomboids. So this is situated on the front surface of the scapula and links to the 8th or 9th rib, allowing it to draw the shoulder blades forwards. And then we have the latissimus dorsi, starting at the iliac crest of the hip. It comes up, connects through the vertebra thoracic 7 up to lumbar 5, passes across the lower ribs, and eventually inserts into the upper arm just here. It's predominantly responsible for bringing your arm back down to your side if you're here or from here, but also it's responsible for inwardly rotating the arm. So they're your surface muscles, but then let's think about the deeper muscles. The deep muscles of the back are the splenius muscles. These attach from cervical to thoracic vertebra and are responsible for lifting your head when it's down. The erector spinae is not actually a muscle, but it's a group of muscles. It includes the iliocostalis, the longissimus, the spinalis muscles, and that are varying lengths running down both sides of the spine, from the cervical all the way down to the lumbar regions. And they produce movements, including lifting you from a bent position, bending the trunk to the side, and also a little bit of rotation of your upper body. The transversospinalis muscles, namely the semispinalis, the multifidus, and the rotator muscles, lie a little deeper than and generally shorter than the erector spinae, but they perform almost an identical function in extending, in lateral flexing, and in that little bit of rotation of the spine as well. Then the segmental muscles are the deepest, and they actually will only link from one vertebra to the very next, rather than connecting several as the previous muscle groups did. The interspinalis assist in extending the spine, and the intratransversarii assist in bending to the side, although all of these muscles in these groups have a very limited amount of force. So the spine's obviously the most important determinant of our posture, described in the Cambridge University Press Dictionary as the way in which someone usually holds their shoulders, neck and back, or a particular position in which someone stands or sits, etc. So good posture refers to a balanced body position that allows for movement with minimum effort, and this should be a proactive state from which the body can accommodate external forces and respond with strength, mobility, stability, or a combination of all these three. Poor posture will decrease the body's ability to handle gravitational stress, and it'll compromise functional ability, leading to possible physical issues. Whereas aligning the body correctly allows structural stability and creates harmonious movement patterns. A proactive posture will result in both lumbopelvic and scapular-thoracic integration, together with optimized unilateral and bilateral relationships. So let's break this down into three key postural areas we can look at. Firstly, the lumbar region. So in a neutral placement, the normal curve is slightly convex anteriorly, just here. Yeah? And this is the most stable and optimal shock-absorbing position. So while breathing and engaging the abdominals in this position, no strain should be felt through the spinal extensors in the lumbar area. If muscular tension does occur here, you really need to veer the pelvis towards a slight posterior tilt and a slight lumbar flexion to take that away. Now, the normal curve of the lumbar spine will lengthen through flexion, yeah, by engaging the oblique abdominals that brings the pelvis and the ribs a little closer together at the front. Let's have a look at the thoracic region. We'll move up slightly now. Stabilizing the scapulae on the rib cage is important, as when it's not done, there's a tendency to overwork the upper trapezius and the other muscles around the neck and upper shoulders that we talked about earlier. Although the scapula move with the arms, a sense of stability, not rigidity, should always be maintained. So keep the feeling of gently sliding the scapula down at the back and towards the spine in a sort of V movement. So even though they may not stay still, they might actually elevate when you lift your arms. The feeling is still keeping them down rather than the shoulders. So the shoulders should be allowed to move, but not to fall forwards or squeeze together in this way. And then finally, let's look at moving up again to the cervical spine. And here, we're looking to hold a natural curve so that the skull should balance directly above the shoulders when in a neutral position. So in most instances, the cervical spine should continue the line created by the thoracic spine during flexion, extension, lateral flexion, and rotation. So having established that the key to the spine functioning optimally is the maintenance of this curved alignment, we now introduce the concept of core strength. Essentially, strength from the muscles in your back, abs, and pelvis working together. Remember, we talked about that harmonious movement pattern earlier. Now, this is currently a hot topic in health and fitness industries, as not only is it vital in protecting the lower back from injury, but research has also shown that it's an important contributor to sports performance. From a health point of view, weak core strength can lead to an exaggerated lumbar curve, or what we call lordosis. Now, this results in uneven pressure on the intervertebral discs, and that can lead to accelerated demise. In sport, poor stability in the lumbar spine, again due to this low core strength, can negatively affect the functioning of the legs and actually increase the risk of injury. So to understand core strength, we must appreciate how the musculoskeletal system works as a set of levers. Therefore, the fulcrums of these levers must be adequately stabilized for optimum force generation. So we can define core strength then as it's the ability to maintain correct alignment of proximal body parts in order to heighten the efficiency of distal body parts during movement. So what we're saying there is being able to fix our center while we're moving the arms or legs will allow us to generate more speed, power, and strength through them. So bracing the lower spine will allow us to sit and stand without risk of injury, but also will allow the tennis player to produce very powerful two-handed winners down the line. The secret to maintaining core stability lies in generating intra-abdominal pressure. because this then lends support to the spine in motion or under duress. Intra-abdominal pressure is brought about by the combined action of the transversus abdominis here, the pelvic floor here, the multifidus at the back and the diaphragm at the top. These muscles work in unity as contraction of the pelvic floor leads to a co-contraction at the back in the multifidus, so stabilizing the sacrum. Also, we then get a co-contraction in the transversus, which begins to pull in here. That in turn attaches to the thoracolumbar fascia at the back that pulls in. And so the end result is, through all this pulling in, we have an increase in the intra-abdominal pressure. So now we've mentioned a few new muscles here, so let's just take a look at them in a little bit more detail. The transversus abdominis is the deepest of the internal abdominal muscles. Because of its origin at the thoracolumbar fascia, this sheath at the back, it's responsible for spinal stability. It causes compression in the abdominal cavity when we pull in. The pelvic floor has three major compartments, the anterior, middle and posterior. Now, the peritoneal cavity is the fourth layer, with the fascia sometimes being counted as part of that layer or sometimes being considered as a fifth layer. The thoracolumbar fascia, as I've just mentioned, is this diamond-shaped connective tissue in the lower back area, and that consists of three layers that are critical in stabilizing the trunk, particularly when transferring load from the upper body to the lower body. It's attached to many other body parts, including the spine, the ribs, plus a number of muscles, even embracing the erector spinae between its three layers. Tension within this fascia can be increased through motion of the arms, maybe through the trunk and maybe through the lower limbs. You'll begin to feel that at the back. So how can we effectively target these muscles through exercise to improve our core strength? Firstly, we need to use free movement and avoid fixed resistance machines that you find in gyms, because they put you in a certain position and then support your movement. So actually, they allow you to switch off your core muscles. In addition, most of these machines isolate movement so that only one group of muscles is working at any one time, which is contrary to how we function in everyday activity. So a better option, therefore, is to practice what are known as compound movements using several muscle groups at the same time. So I'll give you an example, something like a squatting exercise where I'm using here and here and here and a little bit of here. Everything's working together. So you can do this using body weight or with free weights, as both have been shown to force you to switch on your core muscles before you set out on your first repetition. This is something known as pre-excitation. So squats, press-ups, same kind of thing. It's a body weight exercise using a number of muscle groups. So in these type of exercises, the core muscles have to work hard to maintain your natural, comfortable curve of your spinal alignment, referred to as your neutral spine. This ensures there's minimal stress on the soft tissues surrounding the spine, such as the ligaments and the intervertebral discs. You should really consider balance when approaching core training, as any exercise program should develop limb strength in a coordinated fashion from left to right, from front to back, and from upper to lower. A perfect example is the increased risk of hamstring injury if the quadriceps at the front of the thigh are too much stronger than the muscles at the back. That's the hamstrings. Now, exercises for the lower back should build strength, but also improve your range of motion. The route to a healthy back involves 5 steps. So let's go to work in the studio and show you how we can do this. Some simple exercises, and you can do these with me. So press pause, stand up and get ready to join me on these exercises. Our first exercise focuses on improving the movement patterns that you use every day. So we're working on our coordination here. So this is what we're going to do. Taking a medicine ball. I've got a medicine ball here for Peter. It could actually be anything, any sort of weighted object. Because the idea is this is something you would do in your everyday task with everyday objects. So the aim of the exercise here, combining those movements, is to reach down to this side for me, please, Peter. Okay, so in this position, what we're doing here is we've got a little bit of flexion. We've got a little bit of rotation as well. What we're going to do then is lift it up to the high across to the other diagonal and reach. And again, we're working now through extension as we come up and a little bit of rotation. And again, back down to this side, please. So if you can keep that going for me, please, Peter. A few times. Down and then back up. Beautiful. And down and back up. So at all times, what we're trying to do here is to keep the abdominals pulled in tight and be aware of, rather than letting the weight move you or let the arms do the work, it's all coming from the center. Yeah? So we can make this slightly tougher by keeping your arms extended all the time. Does that feel a little tougher? Just nod at me. Fabulous. Indeed. You see there how we can work through that arc, getting that flexion into some extension and some rotation. Obviously, I'd ask you to do both sides. The great thing about this is it's a sort of movement, if you want to take a little rest there for me, Peter. Thank you. I'll take the ball. It's a sort of movement you'll use if you, let's say you've got the shopping. You've taken the shopping home, you're putting the stuff on the shelves. It's that kind of movement. And of course, you can see straight away, those who play golf or tennis, the sporting application for that. The next exercise works on increasing our stability by practicing balance exercises, and again puts a lot of emphasis on core control. So all we're going to do here is a little bit of work on the single squat. So pick a leg. You can't pick your good leg because you're going to do both legs. So we're standing on one leg, you might need the other arm out for balance. What I'm going to ask you to do is simply bend that knee and reach this hand down towards the floor for me. As you can see, it's not an easy exercise. If you start to lose your balance, then reset yourself. That's fine. The single leg squat, try and go nice and slowly, reaching that hand down towards the floor if you can. Excellent. Brilliant. Brilliant. Slow is better. Can I get a couple more? So what we're having to do here is to try to keep your abdominals pulled in really tight to keep your trunk stable. Yeah, that's the challenge. Try to keep the trunk stable. I did say this wasn't an easy one. Brilliant. And again, we're looking for you to practice that on both legs. You're doing really well there. Let's try it on the other leg. Excellent. And take a little rest there. Now, you'll be pleased to know the next exercise is a lot easier. What we also need to do here is to develop a platform of endurance through low-intensity repetitive exercise. This will make a big difference. So what if we take the feet about hip width apart and then just went for a normal squat down and back up, please? Good. Good. Hands as comfortable. You can have them on the hips or both hands out in front, however feels comfortable for you. Again, I want you to focus on keeping your abdominals pulled in tight. Can you keep your heels down on the floor for me, please? That's it. Press the heels down onto the floor as you go down. Beautiful. There we go. Keep the heels down. Don't go quite so low. I want the heels to stay down. That's fabulous. Abdominals stay in tight. Chest stays lifted. And this will start to improve the endurance through the front of the thigh, the back of the thigh, and also into the glutes, into the buttocks. And having that extra endurance strength there is very useful for us. Good. Take a little rest there. We're going to move on now to using functional strength through multi-joint exercises. So this exercise is going to involve several joints at the same time. So I'm going to ask you to take the ball for me again, please. Again, we're facing the front. But what you're going to do now is take your feet a little bit wider. Now, don't do anything just yet, but I'm going to ask you to bend the knees, keep your abdominals in tight. We're going to drop the ball down, and you're then going to bring yourself back up. Okay? So the knees will bend as you drop down, reach a little bit lower. You are bending forwards, and then as you come up, straighten up and straighten the legs all together. So it's a modified deadlift. Away we go, please. So what we need to do here is there'll be a tendency for the weight, again, it doesn't have to be a ball, it can be anything, to pull your shoulders forwards, but we're trying to keep those back. Trying to keep that nice alignment at the back there. We're trying to keep the abdominals in tight, so make sure you bend forward, don't bend the knees too much, bend from the waist. Fabulous. So there's a pull there into the abdominals, so what we're trying to do is keep that pulled in really tight through here and really tight through here. So that's the challenge for the core strength, and you can see we're working through that flexion and extension through the lower spine. Fabulous exercise. One more. And take a little rest there. So a multi-joint exercise. We're working through the hip, we're working through the lower spine, we're working through the knees also on that movement. Okay, so finally, the exercise that we're looking for now is a sort of exercise that will introduce some speed and power. Developing our speed and power is very useful. So this you could do, you can do this on your own if you have a ball and you can throw it at a wall or throw it in the garden. Actually, we're going to do this with a partner. A very useful exercise. What we're trying to do here is to develop a whole body exercise that involves working as many muscle groups as possible, but with some kind of dynamic influence, so that we're working that core strength a little bit harder. So what I'm going to ask you to do is, for this exercise, we're going to place the ball on the floor, and it's what's called a sprint pass. So the idea is to get up, throw the ball, and take a couple of sprint steps as quickly as you can, all in one movement. So are you ready? Up we go. Brilliant. And again, please. Down you go, and up, quick. Beautiful. Back we go. So we're looking to develop power. Down we go. The ball is on the floor, and up and push. And you can see how many muscle groups are working together here. And in order, fabulous, to get that transfer of the power from the legs up into the arms, we need to have a really strong centre. Away we go. And of course, the stronger our centre, healthier our spine is going to be. Brilliant. Can we just get one more, nice and dynamic? You were going to take a rest then, weren't you? Go! Fabulous. Well done, well done. You'll notice that in all of those exercises, there's an emphasis on engaging the core muscles to create that intra-abdominal balloon that braces the lower spine. This helps to maintain the lumbar curve that's essential to take the load off the spine and associated ligaments, particularly in the hinged position, where the long lever of the vertebral column creates a mechanical disadvantage. Now, also in this series is a lecture that looks at the abdominal muscles in detail, and there you'll find a wide selection of exercises, in addition to the ones we just did to improve your core strength, that we've now learned is absolutely vital to protect this intricate spinal structure. So, how does such a beautiful construction break down to cause us so many problems? And more importantly, when the worst happens, how can we get ourselves literally back on track? Well, firstly, we can divide back pain into two different categories, namely chronic, lasting for months and often becoming worse, but without an immediately obvious cause. And then there's acute pain lasting days or weeks, and the result of either an incident such as playing sport or gardening, although it could also be due to an underlying condition such as arthritis. Diagnosis is usually made by MRI, magnetic resonance imaging of the soft tissue, and X-ray of the bone, although electromyography can also be used to test the strength of the muscles and so identify any nerve damage. Sometimes dye is injected into the intervertebral discs or the spinal column, as in discography and myelograms respectively, to highlight damaged tissue. Now, most low back problems don't require surgery but simply pain relief and anti-inflammatories, followed by mobility and strength exercises to return normal function and reduce the likelihood of recurrence. Interestingly, despite the natural inclination to rest an injury, a survey in Finland found that sufferers who remained active healed quicker than those who took bed rest, which has also been shown to lead to the additional complications such as loss of strength, stiffness, and possibly even depression. In addition, research at the University of Alberta on people with back pain revealed that those who engaged in weight training felt it enhanced their quality of life as their joints loosened and the pain subsided. So paradoxical as it may sound then, when low back pain strikes, your best response is not to rest for fear of making it worse, but to actually grit your teeth and push on with being active. Clearly, some injuries will require an initial period of rest, so I strongly recommend you work with the guidance of your physician on setting a suitable plan of action, but remember, I mean action. Let's look at solutions to a few of the better-known conditions. The simplest and most common complaint is due to muscle injury, a strain resulting from an awkward lift, for example. In the early stages, rest is advisable with maybe gentle stretching of the hip flexors that can cause the pelvis to tilt forward. It can also be helpful to gently stretch the piriformis, a hip rotator, because if this is tight, it can cause a knock-on effect to other joints. Core strengthening exercises such as the bridge or a modified side plank and a cat stretch will also help. Sciatica, something a lot of us know about, is characterized by pain or perhaps even numbness in the buttocks and the rear of the lower leg, caused by inflammation and usually as a result of a rupture of the intervertebral disc that begins to impinge on the nerve fibers, and it's particularly felt when you're bending forwards. Stretching of the hamstrings and the abdominals is advised, together with Superman progressions to improve core strength. Lumbar stenosis symptoms are similar to sciatica, but are associated with standing and walking rather than bending. Pain's caused by a narrowing of the neural foramen, or that gap through which the nerve root passes that we mentioned earlier. This could be caused by extra bone growth due to arthritis or advanced wear and tear that again leads to pressure on the nerve. A useful stretch here is to lie on the floor and pull one or both knees into the chest, with a suitable strengthening exercise being to reach the hand to the opposite lifted knee whilst marching on the spot and keeping that neutral or comfortable spine. Now, with all of these stretching and strengthening exercises, always back off if you feel any sharp pain. So, to conclude, it's worth pointing out that in terms of a healthy spine, public enemy number one is poor posture. The National Back Pain Association tells us that 4 out of every 5 people will suffer at some time in their lives. It'll mostly be self-inflicted as a result of poor posture that's developed over many years of incorrect movement patterns and perhaps a sedentary lifestyle. Kyphosis, for example, is a rounding of the shoulders and can result from many years sat at a computer or at the wheel of a car, like so. And a simple exercise we can do, keeping the elbows by the side, lifting the hands out, is a great little exercise to train those muscles that will help to correct that. Lordosis, or an exaggerated lumbar curve, can result from years of sitting. And as the hip flexors begin to shorten because of us being in that position, then when we stand up, they don't fully extend and we have to correct ourselves with this position. So a very simple stretch, like so, pushing forwards here, will begin to stretch the hip flexors there. So something we can do at the end of a day if we've been sitting at the desk for a while. So these exercises are simple, aren't they? And in both cases, incorrect alignment leads to weakness and stiffness. And you don't need me to tell you that these are the precursors to back conditions, either chronic or acute, as we discussed earlier. So whilst I've equipped you with a few exercises to help alleviate certain low back problems, I want you to forget about rehab and start to think about what I call prehab. By strengthening your core muscles now, you'll reduce your risk of back pain, possibly saving yourself a lot of discomfort and a good few dollars along the way. So remember, your back it's the source of support for your whole body, and it allows you to sit, stand, move, and to bear weight. However, it's also a delicate, finely balanced structure that will break down if not cared for adequately. But now, you know the basics of back care, so you can look forward to a healthy back for life.